My brother and I are third-generation physicians in our family's practice. The practice started in the 1930s when our grandfather, a general practitioner, and his wife, our grandma, a registered nurse, started the practice. They provided care wherever it was needed, in the office, in the hospital, and by doing house calls several nights a week. Dad and his partners advanced the practice for decades and provided an exceptional level of care. Despite that, the economics have changed, and despite all of our efforts, the practice was slowly dying. Our first outreach was to join an IPA. Physicians group in southeastern Ohio was formed in 2001 when a small group of independent physicians in our area joined together just to carve out more favorable commercial contracts. And we were very successful with that. But despite that, and despite the promises of pay for performance and ACOs, healthcare had devolved. To survive, our practices and our physicians needed to see more and more patients in less and less time. Meanwhile, our patients were getting sicker, more complex, and had greater and more complex social determinants of health. It wasn't good for us as doctors, and it wasn't good for our patients, and we knew it. We had talked to tech vendors, we had met with consultants. That wasn't what we needed, and we didn't want a hospital system coming in and joining our practice. We needed a partner that could align financial success with doing what we knew was right for our patients. Spending more time with them, seeing them more often, providing a more highly coordinated level of care. That's when our friends from Columbus introduced us to Agilon Health. Agilon presented a new vision, a novel business model in which they could align financial success with doing what we knew was right for our patients. They are helping us get off the treadmill of fee-for-service so that we can roll up our sleeves, work with our partners to build the programs we need to provide better care for our communities. I used to get to the office and look at my schedule and be overwhelmed. Now, I look at my schedule and see 30-minute intervals, so I have time to meet with my patients, connect with them, learn what they need, and help them where they need it. We're seeing reductions in ER visits, reductions in hospitalizations, and reductions in readmissions. The patients are happier and they're getting healthier. So in a way, what began in the 1930s with my grandparents visiting homes and farmhouses across Guernsey County had evolved to the point where now we're creating a highly coordinated, multidisciplinary care team made up of RN care managers, social workers, clinical pharmacists, so that we can provide a much more highly coordinated level of care for our patients. With this partnership from Agilon Health, I'm more optimistic now about primary care than any other time in my career.